Hi, my name is Nate Heckman. I'm from the University of Southern California, Keck Medical Center here at USC. Our talk is entitled The Rise of Medicare Advantage, Effects on Total Joint Arthroplasty Care and Research. So we were motivated to do this research based on our experience in clinical practice. A larger and larger proportion of patients that presented to our clinic seeking arthroplasty care were insured by Medicare Advantage insurance companies. And so the initial motivation was really to just capture this ongoing trend. We wanted to determine the proportion of patients that were enrolled in Medicare Advantage plans and how this trend had changed over time. Some of the findings that surprised me, first and foremost, patients that were enrolled in traditional Medicare were different on average compared to patients that were enrolled in Medicare Advantage. Black patients were enrolled in Medicare Advantage plans at twice the rate as traditional Medicare. On average, patients enrolled in Medicare Advantage plans were slightly sicker and had slightly poorer outcomes, including a higher rate of postoperative infection. And so we were both alarmed by this increasing trend, as well as some of the increased risks associated with patients who had these plans. And we're very excited to research this topic further because of the potential implications that this might have on future research and future clinical care. So some of the questions that remain unanswered, first and foremost, understanding the drivers of this trend, I think is important to further understand, some of the findings that we observed in this study. I think secondly, really understanding what drives the differences in outcomes between these two insurance cohorts, and finding solutions to mitigate those differences in postoperative outcomes, I think would be paramount.